together to update the community health assessment survey. So this gives us opportunities to improve the health of our residents, allowing hospitals to better meet our needs, and for the health department to better figure out what kind of programs and services that we need to offer. So our panel of experts are here this morning. They're going to outline the goals and the preliminary data that they've gathered so far. And I just want to encourage all of our residents to participate in one of the upcoming community meetings that we'll be having throughout the county. So once again, thank you all for joining. Thank you for everybody out there in Zoom world, and I'll turn it back to Director Burley. Thank you.
Thank you, Supervisor Bishop. I'll start off by going through an overview of the meeting today. The kickoff meeting is really intended to provide information on the importance of community engagement in developing and implementing the plans, a general overview of the Live Well Mohave project, and the process that will be used to update the 2019 Community Health Assessment, also known as a CHA, and the 2018 to 2020 Community Health Improvement Plan, also known as the CHIP. We'll also highlight successes of current CHIP work groups, explain how you can get, involved, the influence of the CHA and the CHIP work on hospital strategic plans, and next steps and community meetings that'll be in the next few weeks for you to participate in. So let's start with engagement. Engaging local government, healthcare, schools, social service, support systems, and the public in this effort is critical to ensure shared vision, ownership, and accountability for the work. The local public health system is a complex interplay of organizational collaboration, and each partner accepts their role in creating an environment that supports healthy decisions and options. Together, we can use our collective expertise and experience to empower residents with information and opportunity to make healthy decisions. As you can see from the graphic, the public health system includes public health agencies at the state and local levels, local and state government leaders, healthcare providers, public safety, human services and charity organizations, nonprofits, education and youth development, recreation and arts, economic and philanthropic organizations, environmental agencies, and community members are at the core of this work. I'm now going to turn it over to Terry Williams, who's our Public Relations Director for Kingman Regional Medical Center, who will describe the CHA CHIP and next steps to complete this work, summarize past efforts, and introduce the consultant who's assisting with this project. Thank you.
Good morning, everyone, and thank you so much for participating in this meeting. This is, as you will hear, so important to have community engagement, and all of you joining us with this helps us accomplish our goals. So first slide, please, Barbara. While she's bringing that up, I'll give you a little history of what this initiative is and why we do it, I guess. First of all, our goal overall is to engage our community to improve health in our community. And when we talk about health, we're talking a whole gamut of various parts, if you will, on what defines health is our environment, our families, our access to health care. There's many, many things that contribute to health in the community. So this initiative began almost 10 years ago. Through the Affordable Care Act, hospitals were required to hospitals were required to do a community health assessment and a community health improvement plan to inform their planning. And when I say hospitals only, this was only a requirement for nonprofit hospitals. So the reason why KRMC is involved in this is that we're the only nonprofit hospital in Mohave County. So we had that requirement that came through the Affordable Care Act. At the same time, the Public Health Department had a requirement to do the same thing, a community health assessment and community health improvement plan to as part of their accreditation for the health department. So back in 2012, we started this initiative. We, rather than each entity, KRMC and Public Health, do separate assessments, we partnered to do this together. We're talking about the same community. So the initiative first starts with a community health assessment. What a community health assessment is we're gathering statistics, facts, public input on what are the health needs in the community. We're looking at, and you'll hear later on today, we're looking at all different kinds of statistics and data, everything from traffic accidents to incidences of various chronic health conditions. So all of that is documented in a report called the Community Health Assessment. Next, based on the data in that health assessment, we engage the community to look at that data and identify what are the priorities, what are the things that we feel as a community that first we can address, and then secondly, what's important to address? What can we do something about as a community together? And then from that initiative, we, as community groups, and you'll be hearing more about that, we then form community action committees to address those issues. So for an example, the last time we did a community health assessment, well, actually, and I'll back up, we have done this every 3 years. So we had a community health assessment and community health improvement plan in 2013. Then again, we went through this process in 2016. And then in 2019, we did do a community health assessment. However, because of COVID, we didn't do the community health plan part. And that's what we're launching into right now. So from that, and I'll give you an example, in the community health plan and bringing the community together, one issue that the community continually over and over again feels is a huge issue is mental health and mental health care. And so there was, so we formed a community action committee called the Mohave Mental Health Resource Team. And that team has been meeting monthly for several years now and dealing with issues having to do with mental health. So when you look at that bottom row of community action committees, we have currently several community action committees that are in process and in place. And you'll be hearing from a couple of those today. One overall thing that I think is important to see here is you see that blue circle behind this whole thing. That means community input influences this entire process. And that's why it's so important that you and whoever else within our community that has interest in community health are involved. And then lastly, you can see the purple boxes on the left, or on your right. So all of this input, this planning, the data, the plans, what the community sees is and says are their needs and priorities, influences planning both for public health and for the hospital. And you'll be hearing a little bit more about that today too from Will McConnell, our CEO, who will be talking about how all of this input influences hospital planning. So with that, I'm sure this is complicated, but please ask questions, send them in, and we'll try and address those. And with that, because of this complicated effort, we end up needing all kinds of expertise and support. With that, Eve Ford with Eve Ford Consulting will be guiding our efforts this year. And as we go through developing a community health improvement plan. And let me back up. I just want to make sure that you see this, is that you'll hear lots of times we're terrible about using the acronyms. You'll hear community health assessment, or CHA. You'll hear us say CHA a lot. I apologize that we do that, but what we're talking about is that data and statistics that are a picture of local health within our community. So that's the assessment. Then we will develop a CHIP, or a community health improvement plan, where we identify priorities and needs from community involvement. And so when we say CHIP, that's what we're saying. So with that, Eve's going to help us with updating the CHA, facilitating community meetings, and then developing our CHIP for this year. So with that, Eve, I turn it over to you.
I called Plan Ops about the HVAC, so hopefully they should.
Thank you.
Thank you.
Good morning, everybody, and thank you again for attending this kickoff meeting. And if you haven't done so already, we just ask you to put your name and contact info in the chat box. We're kind of taking attendance, so that really helps us. Thank you so much. And thank you, Terry, for the introduction and the information. As Terry has been saying, we are launching into this action phase of engaging you in a lot of community input opportunities. And I think as Barbara brings up my slides here, I will go straight to a model that is a national model recognized for community health assessments and community health improvement plans, and that is called MAP. It's Mobilizing Action Through Planning and Partnerships. And so as that slide comes up, I'll show you we are at the very top here, organizing and engaging you as partners, as an organization or individuals. If you go around to the right, there is the vision for the community health, like what is your vision, your hope for vision in Mohave County. On the health department website, we have 3 visioning questions. I just want to invite you to fill those out another time. And that's another important thing to talk about, is the vision. The next step in the MAP model is getting community input. We will be having these community meetings that we'll talk about in just a few minutes, and it is your opportunity to engage with us, and we really appreciate that. The bottom of the circle is identifying issues. Terry had talked about identifying health priorities. There's a process to this. We want to hear from you. There could have been changes over the last few years, so that's really important. The next, going around the left side of the circle, developing goals and strategies. We just are asking the individual community groups that are working together that they set some goals, maybe continue those that they have already set, look at their strategies, and that they work together. And the last box there, the action group, that is where you as community members really drive this whole process. So I'm ready for the next slide. Just want to mention, why is Live Well Mohave important? It empowers you as the community to work together. It helps build powerful partnerships and reduces silo work on health issues, maximizes the use of your resources, minimizes duplication of effort. And lastly, particularly as Terry pointed out, it is a best practice for health programs, whether it's local hospitals or public health departments. Next slide, please. Okay. And the Live Well Mohave process, just talked a little bit about that. The Kingman Regional Medical Center and the Mohave County Department of Public Health are already working to organize and plan this process. We are now starting to engage you and others in the community. We've talked a little bit about the community health assessment, and Mayor Schumacher, who will follow me, will be giving you a little bit of detail on that. The next bullet, holding community meetings to identify priority health issues and develop implementation strategies. We'll show you the schedule of that, and it will be posted on the County Health Department's website. The next bullet would be building up the current community action committees, the CHIP work groups, or create new ones. Some of you in particularly the more rural areas do not have a CHIP work group, and you might want to do that. And the last bullet, evaluate progress toward CHIP goals and outcomes. Kind of the, how do we know we have success here? The roadmap you see in front of you is a visual portrayal of what I've just been talking about. If you look at the upper left there, June, we were gathering data through the survey, July, analyzing that data for the CHA, July and August, we're holding community meetings, and then going to your right, in September, I will be compiling data and writing reports. October, we will have a conclusion and celebration in probably mid-October. And on the far right, November, we will be in an action cycle ready to implement this. So, and here's the timeline with a little bit more detail. I've already mentioned, that June, we've already accomplished this as far as gathering that health data, very important, and thank you to those who filled out our survey. In July, there's going to be a lot of analysis and additional research and updating of the community health assessment. July and August, holding the community meetings, mobilizing the CHIP action groups, and reviewing the progress. So on the next slide, we have September. I'll be compiling all this information from the community meetings. So please do attend and give us your input. I'll be writing the summary reports. October, we will have the celebration and conclusion and share publicly what we've learned by listening to you, and that as these community meetings happen, that you listen to each other. November, we will be going into full action cycle of implementing those CHIP strategies. And it's important to note that the health department is offering to assist CHIP action groups as appropriate. These are self-directed groups, but the health department wants to support. So now I'd like to introduce Mayor Schumacher. She is the epidemiologist for Mohave County, and she will give information about the update of the community health assessment. Thank you.
Hi, everyone. I'm Mayor Schumacher. I have been an epidemiologist in Arizona for about 20 years. I've been with the Mohave Department of Public Health for about a year and a half. If you think about what started a year and a half ago, that makes perfect sense, because epidemiologists are the folks who look at disease data and help do disease control for outbreaks. We also look at overall trends and information about health across the community. Barb, when you're ready, you can put those slides up.
Just 1 second, please.
Oh, no problem.
I'm having trouble hearing you.
So my mute is off. Can you hear me?
I'm trying to get this presentation. Presentation, but I'm trying to get her to continue. This is presentation. This is.
We should mute ourselves. It'll be easier to hear.
Can anyone indicate if you can hear me?
I can hear you.
Thank you. So continuing on, my role in the Live Well Mohave project is to gather data to look at what's going on in the community in terms of health. And health data is very important to the whole process, just as community input is. You can go to the next slide. So one of the outputs we're gonna have is this community health plan. And what we're gonna have input from everybody, but our individual views of health and of health in the community, of course, are different than the overall views. So we'll have as inputs into the plan, community input or our own individual and community views, demographics like income and gender and age, things like that. And then we'll also have the input that I'll provide, which is quantitative health data from a number of sources. Now this is the way that we can separate my view from the bigger view of the community. So if you asked me, what is the biggest cause of accidents? I would tell you from my view, it's mountain biking accidents, because a lot of my friends mountain bike, and for some reason, a lot of them end up falling off of their mountain bikes. However, that probably wouldn't be a good, accurate view of the community. So what I try to do is look at big data sets and look at the information we've gathered and try to figure out what's going on across the whole community. So I'm going to give you a couple examples of health data that we'll be using. And these are actual numbers, but we're going to have a lot more in the future. So cardiovascular disease is the #1 cause of death in Mohave County. So that is our big, health problem from death perspective. The second one is cancer. Another statistic we have is that 4 out of 10 residents are obese. And I like to use a cat here so that we don't really have to look at ourselves. But this is important because, of course, obesity leads to what we saw before, heart disease, diabetes, and a number of other chronic conditions. The third example is about healthcare. From the survey that we did, and I hope you all filled it out, there were about 300 responses. And what we found is that a little over half of the people go to a doctor's office most often when they need medical care. The rest of the time, they go to an urgent care, a clinic, even the emergency room. So this is important to know. Now, why are the health data so important? Why do we use them? Well, it allows us to look at the whole community, not just our own personal experiences, as I mentioned earlier. It also allows us to look at different groups and see what their issues are. What are the issues for seniors? What are the issues for children? That sort of viewpoint. We can look at trends over time. So are we having more diabetes than we did 10 years ago? We can try to figure out why as well. And institutions such as hospitals use it for strategic planning and to see what services they can offer to us, to the patients. Now there's lots more of this coming in the community meetings. I hope you'll come because I'm going to have a lot of data to share with you at that point, both from the survey and from other data sources. Thank you, and I'll see you there.
Can't hear you, Terry.
You're on mute. You're muted.
Okay. The wonders of Zoom. Thank you so much, Mayor. And I'd next like to introduce, as I was talking about, we have several community action groups, one that are in place that have been meeting for years. Again, one of the health priority issues that seems to come up over and over again within our communities is substance abuse and treatment for substance abuse. And so one of our community action groups is one that existed actually prior to the community health, this whole Live Well Mohave initiative. However, because substance abuse constantly comes up, we've incorporated, or we some of the goal setting and whatever they do are part of this effort. So I'd like to introduce Bob DeVries and Dr. Sarah Knievel with MSTEP, and I will give you, rather than the acronym, you will give it. Right? What it says. I thought I had it written down here, but I don't. So anyway, I'd like to introduce Sarah and Bob DeVries to give us just a recap of some of their successes as a community action group. Thank you.
Morning. It's like our Zoom meetings. Get in real close.
Yeah.
Thank you for joining, everyone. Yes, MSTEP has been around since 2014.
Yes.
And we started after the Arizona Health Department noted that there was a problem with overdosing and created an action plan. And MSTEP went ahead and started implementing some of the rules and plans to help with the community regarding that. We continue to do that. And we are a nonprofit organization, Mohave Substance Treatment
Education Prevention Partnership.
There you go. It's a mouthful. We made it initially, and I would love to change it, but we've got so many things going with it now that if anybody can think of something better, we'd like that. Anyway, so about 18 months ago, right before the pandemic started, we were blessed with a grant that we applied for through the federal government. And it's about $750,000 is about what the working cost was for us, which has allowed us to expand, find employees, pay them for all the wonderful work that they're doing. After Bob retired from Chief of Police for Kingman KPD, he was gracious enough to join our team. And that is when things have really taken off for us. We have law enforcement in our group. We have community people in our group. We have county department members in our group. We have the health department. We have medical professionals too, behavioral health, and regular pain like myself. So I'm really proud of the work that we've done. We have a couple other smaller grants that we're working with through, what's SACLA through?
Through the Substance Abuse Coalition leadership.
And then another one with Health Choice or Access is something that we're doing for educating kids and using art as a way to talk about their experiences with substance use. So Bob is going to review some of the wonderful things that we've done. And just before you start, I want to say this morning I read on the news that 2020 was almost 1 million deaths. We had about 90, or not about 100,000. What was it? What, 9? It's a 30% increase from the year previous of opioid overdoses, which we can expect with the isolation that occurred with the pandemic and the rise in illicit fentanyl. But we're actively working against that. So go ahead.
And with that, was just released yesterday about the 30% increase in regards to opioid deaths last year. And getting ready this morning, watching TV3, Kingman was on the news. And so often you would hear if there was something bad going on, Kingman was the one that was being put out there in Mohave County. Well, guess what? We were in the positive light because the anchor was talking about the positive things and the great things we're doing here in the county, which was also supported by one of the experts that they had on there. So I would ask everybody, July 28th, keep that date in mind. There's going to be a significant coverage that's going to be going related to the opioid crisis. And they're going to be highlighting some of the great programs that we're doing here in the community. And that's one of the things I just wanted to touch on is as we move forward with this, all too often we just look at the big problem in front of us, which is important, but we fail to recognize and celebrate the successes that we've had. And we've had some significant successes over the past few years. And as Dr. Knievel mentioned and Terry mentioned, all of the coalitions in the Kingman area here really have merged into MSTEP so that we have a one focused collaborative group to move forward with everything that's going on. Some of the things we've been able to achieve through our physicians here, we achieved 100% participation and involvement in the prescription drug monitoring program. That alters back and forth, but to hit 100% is huge. We've implemented countywide drug drop boxes in every law enforcement agency in the county. We've literally collected thousands of pounds of expired and unused medication. We were able to drop from the #1 overdose death rate in the state to #3. Obviously, we still have more to go, but we're moving forward. Kingman was the first law enforcement agency in the state to train and provide our officers with naloxone, saving dozens of lives. Now, over 80% of law enforcement agencies in the state are carrying naloxone. We were the first rural community in Arizona to implement a harm reduction program, again, having an impact with that. We're also the first community in the state to implement an overdose mapping program as a pilot. We're now working with Lake Havasu City and Bullhead City to expand that to countywide in hopes that it'll eventually become statewide. We've developed an overdose fatality review team. We've developed an early intervention program in our Kingman Justice Court named Quality of Life Court that focuses on first-time offenders or low-level offenders trying to catch the disease on the early end and the front end versus waiting for the disease to really set in. We've placed a caseworker in the Mohave County Jail that's helping to guide these individuals into the type of treatment that they need. And one more date I want you to remember, and that's the 15th annual Walk Away from Drugs here in Kingman, and that's going to be on October the 20th. And that's viewed, and we've been listed by state officials as the largest and longest running substance abuse prevention and treatment event in the state of Arizona. So folks, we've got a lot to celebrate, and we have made a difference, and we're going to continue to make a difference. So thank you for the time.
Our meetings are at the third Tuesday of the month, and they're now going to be at KRMC, but we do always offer a Zoom option at this campus here from 3 to 4, 5. I cut it pretty short. So we'd love to see more participation from our community members, even though I recognize most of your names. But thank you again for the opportunity to talk today.
And for those that are attending next week, we do have a special presentation that's going to be provided by Susan Williams from the Health Department on vaping, which is a significant problem, not just here in the county, but across the nation. So it will be very informative, and I would encourage everyone to attend. Thank you.
Thanks.
So I think that's an absolutely amazing example of the power of community engagement and what can be accomplished. It reminds me of a quote, the most powerful factors in the world are clear ideas in the minds of energetic people of goodwill. And that's what's happening here. So next, I would like to introduce Sue Blair White, who leads up our mental health resource team. And Sue, welcome.
Thank you. Well, good morning. It's so nice to see so many of you that I haven't seen for a while. Excuse me, my allergies are not being nice to me today. Do you have my slides? Or not there. So I want to reiterate what Terry just said and what Bob said in regard to community partnering. I have lived in a number of states, different counties, and I have never been as impressed as what I am with the Mohave County communities. They're just amazing, just amazing. And as I go through this, we have someone in the room, Julia, who helped a lot. with some of the projects with the mental health resource team. And so at any time, if you want to correct me or say something, feel free to do so, please. And thank you. So you were already told what the acronym means, but I wanted to put it on there anyway because sometimes I forget it. And we can just move right through this if you want to, Barbara, to the next slide.
Not working.
I went through the last couple chips that were compiled, and again, I was impressed. That's and there were 3 priority areas. One, of course, was mental health. The second one was substance abuse, and the other one was wellness. We say wellness versus obesity because of the stigma. We're always fighting with stigmas in this area, and that's okay.
Bottom right is the scale, it's plus.
What I think is important to know about the mental health resource team is that it is comprised of county-wide memberships, and people can show up in person, of course, or they can Zoom in. What is nice is they're well aware of, because of the complexity and differences in this county of different cultures. The membership at Mental Health Resource Team is comprised of multifaceted people from all around the community. The last few months, we've also got someone from the tribal areas, which is great. Mohave Mental Health, we look at the goals from the CHIP in the areas of concern from the CHIP. We also are aware of the fact that mental health, substance abuse, human trafficking, domestic violence, and opioids crisis, they're all pretty entwined. And the power of the mental health resource team is individuals from around the county come in and they tell us what their gaps in services are. And they have always related to the CHIP and the prior CHIPs. And then it's laid out there who wants to be a work group for this. And I want to talk real quickly about a couple of the goals that we achieved. When we're talking mental health, of course, suicide, which is a huge issue for the entire state, but particularly in Mohave County. And the group has gotten together, and for the last 2 years, of course, we were interfered with COVID. We have made planning goals, not we, the group. MHRT group has made planning goals in regard to what is a priority. And just before COVID hit, it was decided that we needed a support group for people who have died from suicide. Not only is it a horrible stigma, it's complicated with substance abuse, and of course the isolation has increased it, etc. And what happened was a group of 5 community members got together for an hour and a half every Sunday for 5 Sundays, and they came up with a mission statement, a vision statement, a program, admission criteria, and who would be qualified to facilitate the group and who would be willing to facilitate the group. The name came from one of those members. I put the co-facilitator's name on here because they deserve so much. Even through the whole COVID process, they found ways to connect with everybody who called in and was interested in the support group. The other thing I want to throw out there, and if I go over, you can tell me to be quiet, is that I think they really deserve this recognition. Bullhead City contacted our group and said, hey, we have a group also. And so Karen and Susan connected with them and connected with the group over in Lake Havasu City, You Matter. And they made an agreement that they would give out their meeting information. So if for some reason during 1 week, the person who resides in Kingman can't present for the group, then they have the option of going to one of the other groups that week so that they have that ongoing support and contact throughout the whole county. And again, Karen and Susan have done an amazing job with this. This is one of the success stories of MHRT, mainly the community in Mohave County. So another success story, and this one just totally amazed me. My role is not to be the leader in these groups. My role as an MHRT individual is to just assist community members in regard to how can we fill in the gaps. But these are their programs that they created. We had one meeting, it was February of last year, in regard to human trafficking and domestic violence, coalition development, and then COVID just slammed us. However, that did not stop this community. They called the state people, like the McCain Institute, different places. They got Zoom in trainings for everybody who could attend from home, because of course we couldn't attend meetings, and they became stronger and stronger and stronger. This is now a coalition that is overseen by AZYP, and it is made up again of community members from throughout the county, and that does include the rural areas. Not all of them yet, I'm still pushing for that, but it's pretty amazing. And so Futures Without Fear, you're going to be hearing that a lot. Human Trafficking, Domestic Violence Coalition. And the next slide kind of talks about, again, by October of last year, even with the COVID, we had an increase of 6 participants to, I think it's like 20 now. And there were so many, we now had to split up into smaller groups. But they came up with the vision statement, the mission statement. There's a chairperson, there's a co-chairperson, and people have various interests in regard to human trafficking and domestic violence. And so now there are 4 subgroups to address. And if you want to know why we don't have a specific coalition for domestic violence and a specific coalition for human trafficking, during one of the MHRT meetings, an expert from domestic violence and an expert in human trafficking were at the meeting. And when I said, when are we going to start working on this? They both said it has to be one coalition because you can't separate the two. And then I was asked, because I'm under an opioid emergency intervention prevention grant, how does that fit into this? And some research was done. I did the research, and trust me, I was honest about it because I was concerned. And it showed the increase, the high rate of opioid dependency with people with domestic violence and human trafficking. And of course, that's part of the way that perpetrators control them also. So it's rampant. And so those are 2 what I think are very strong success stories that the entire county should be very, very proud of. The work behind the scenes, like I said, was amazing. They never stopped. COVID did not stop this group of people. They all went in different directions and all came together with all the Zoom stuff. And that's what MHRT is all about, is not just working on what the chip shows us we need, but also listening to the community and hearing their needs and gaps throughout the entire county. And we are increasing that philosophy in the rural areas. So please hang in there with us. So I don't know if I went over or not, but that's all I got. Okay. Did I go over?
You're good.
Okay.
Thank you.
You're welcome.
So thank you so much, Sue. And I just have to say that we are so fortunate to have her in our community. She is an expert in evidence-based mental health care. And to have her leading our MHRT team is amazing. So thank you for all you do. Next, I'd like to introduce Will McConnell, who is the Chief Executive Officer at KRMC. And he'll be speaking about how all of this activity influences hospital planning and strategies. So with that, Will?
Thanks.
All right, good morning, everyone. Appreciate everyone being here, because ultimately the opportunity that we have is to really work together as a community in a different way. I want to speak to some of the comments that have been made earlier before I get into how the community health assessment and these other activities work with the hospital when it comes to strategic planning. So Eve talked about silos, and silos as they relate to community health assessments is a big deal. It's also a big deal both within the hospital itself and in the community, because ultimately when we work in silos, we're so focused on what's in front of us that we forget the input and the output, right? What we're doing, we received from someone else, and what we're providing is someone else's input. And so when you talk about a community approach to livability and live well Mohave and mental health, the community as a whole needs to start looking at how we transition care in the community differently. Those silos actually create situations where instead of handoffs happening and a coordinated effort of moving someone through the healthcare system in the community, we end up with the individual having to figure out how to navigate the system. And if we're working together as a community and breaking down those silos, that means we're taking a more proactive role in moving individuals through the healthcare system in its entirety, which is going to create a much better experience, right? Because if you're sick and you're trying to navigate the healthcare system, and it's long-term care versus hospital versus trying to get care, and you have to focus so much on actually getting the appointment rather than getting better or addressing the concerns. So ultimately, through the community health needs assessment, and we call it community health needs assessment on the healthcare side, community health assessment in kind of the community side. But when it comes to that, it gives us an opportunity to look at, okay, here are the areas that we can really start working together as a community, rather than just each kind of focusing on what's right in front of us. The other thing I want to talk about is living well versus livability. And Live Well Mohave, I like what that's speaking to, and that also needs to address livability. And that's one of the things from a recruitment standpoint, when we're looking at bringing people into this community, that livability component is a big deal. And I saw in a couple of the earlier slides, walkability, bikeability, these free and easy access to health and wellness, right? That's going to be beneficial not only for the mental health side, but also for prevention and wellness, which we really need to start getting in front of as a community. And then the last thing before I talk specifically about how it relates to strategy is this notion of stigma reduction. Stigma reduction is a big deal. And when you look at the impact that mental health has on other health issues, the mental health and behavioral health component is usually one of the underlying factors. So when we're dealing with a comorbidity, oftentimes we're dealing with a symptom of something else. And again, if we're not looking at this as a community and we're not looking at opportunities to look at the whole person, what we end up doing is we focus on symptom management and we never actually get to the underlying condition. And from a healthcare delivery standpoint and from a hospital-based standpoint, our ability to partner with mental health and behavioral health institutions, long-term care facilities, really kind of closing the loop on the entire healthcare chain is a critical aspect of this. And that to me is the biggest impact to the strategic planning relative to the hospital, is how do we start to connect the community better through taking care of people. And that stigma reduction, it's a big deal. And suicide is a huge factor. One of the communities I lived in before this had a rash of suicide, and there were a lot of deaths by suicide, including my kid's fourth grade teacher, including one of my other children's actually counselor in the school. And the unfortunate thing about that tragedy is it really forced people to start having the conversation. And we started changing the language around suicide. Death by suicide instead of committed suicide, which really kind of just drives it underground, right? Suicide attempt and successful versus unsuccessful, which that's inappropriate, right? Mm-hmm. So a lot of these things, we just need to start coming together as a community more and looking at this as how does the community create an opportunity for everyone to live well. And that means we need to have better coordination at the access points across the delivery system. So relative to the community health assessment and KRMC's strategic plan, really we want to find opportunities to partner directly with other community entities that are really focused on this work. Because ultimately, you know, if you see the sign outside of Kingman Regional Medical Center that says it takes all of us relative to COVID, right? The same thing applies to mental health, to obesity, to wellness, et cetera. So that's my plug.
Well, and thank you, Dr. McConnell, for all those encouraging comments and emphasis on making connections, because truly this work is about all of you all and the different components of the community coming together to improve public health. So my job now is to finish up to tell all the audience here for the community meeting schedule, how you can get involved. And yeah, there's the 7 meetings that we have planned over the next few weeks. We will have 3 meetings in the urban cities of Kingman, Bullhead, and Lake Havasu, and 4 that are very important rural areas, Dolan Springs, inviting also Meadview and Chloride, Beaver Dam with Littlefield, Golden Shores with Topic. Did I pronounce that right? Mm-hmm. Oh, good. Okay. I want to make sure and get that right. Mm-hmm. And Colorado City. So you will see a schedule of those on this slide here. The dates run across the center, and the locations and the time details are there. So we really want to encourage you all to choose one of those community meetings and show up. We need your involvement. Want your involvement. We'd love to have conversations with you. And these are the topics that we'll be talking about at community meetings. As we've mentioned, we'll be going over the updates to the community health assessment in more detail. Here's a really important one in terms of, I think one of our first speakers, Bob, mentioned that every community has health assets, and I couldn't agree more. You know, there are some positive things in each one of these areas that can be leveraged if we work together, and we will be talking briefly about these health assets. Next, the participants will be encouraged to review and discuss current CHIP priorities, modify, change them, and if you want to keep those goals as is and the strategies as is, that's fine. But we just want to give you an opportunity to look them over and see if they need any adjustments. We will ask you as participants to give input of how do we evaluate and monitor progress. We've heard about all the wonderful successes. You know, how do we document that? How do we capture data on what's making the changes here in Mohave County? And the last thing is for the rural communities who do not currently have CHIP work groups, we will be asking you if you want to form a local action group and choose your health priority issues. These are the health priorities currently reflected in the 3 CHIPs that you have now for the urban areas: mental health, substance abuse, healthy living, which is in some, I think in some as obesity prevention, it could be diabetes, whatever, and teen pregnancy prevention and access to healthcare and social services. And I just want to mention in these community meetings, you can be choosing your priorities and goals according to what is important to you. For example, very practical, maybe start a walking group together. Choose the progress indicator of the number of people who lose 5 pounds for walking over a 6-month time period. You know, something very practical, very simple that you choose. So the last thing in terms of how you can get involved, you saw the schedule of the 7 community meetings. And again, the schedule will be on the health department's website. Encourage you to get involved with one of these exciting countywide community action committees, the MSTEP or the mental health resource team. Start a community action group of your own, the CHIP work group of your own, focused on your health issue that you agree on. And if you're interested, please email us your contact information, livewellmojave@mohave.org. mojave.gov. And for the questions and answers, if you do have questions, kind of the what's next, or I want clarification on this or that, please send them to livewellmojave@mojave.gov. You can send them to the chat box for this meeting. Thank you all for attending. We will be emailing all of you who have attended today the answers to your questions. Just want to thank you again to KRMC for hosting us. Thank you to the Health Department for this collaboration. All the speakers that gave you the very positive, very exciting updates. It sounds like Mohave County is on the move. And thank you to all of you. And appreciate your time together. And that concludes our meeting today. Thank you.